Voy a presentar a nuestro siguiente speaker, es el doctor Christopher Walker, que también nos acompaña desde Estados Unidos. También nos va a hablar en inglés, pero tenemos traducción simultánea. El doctor va a hablar sobre los péptidos y la nueva generación de terapias regenerativas con péptidos. Doctor.
Buenos días. It's a pleasure to meet all of you. I'm originally from Jamaica, so I'm going to speak very slowly. Please feel free to interact with me as I'm chatting with you all. So, my specialty originally was urogynecology, female pelvic surgery and robotic surgery. And I lived in the United States where I have practiced that subspecialty and became very intrigued in the whole arena of regenerative medicine. After realizing the potential of regenerative medicine, and to Dr. Gavek's credit, I love that lecture, by the way, it's the new wave. It's something that I incorporated in my pelvic surgeries by incorporating the stem cells and the exosomes. The patients would walk in 2 weeks later and have amazing results, minimum scarring. And I realized that I needed to think differently. I needed to have an open mind. And with that said, I transitioned my practice over to one whereby I really focus now on purely regenerative medicine, and I combine different therapeutic interventions. So, my colleagues, I will chat with you about something that I'm very excited about, and that is peptide medicine. I personally have used this. I will show you some pictures of myself and my patients. It is a fascinating science, and you're going to say to yourself, what is Chris talking about? What is this he's mentioning about peptides? So let's go back to the beginning of medical school. And as you will remember, what are peptides? They're a string of amino acids. They're the building blocks of proteins. And essentially, in summary, what is it really? It's a biological messenger. And the thing is, there are over 7,000 peptides today. And what it really is, it's a communication between it's telling the body what to do. It's a form of communication to the tissue. And what I love about it is that it's highly specific, well tolerated, and when administered, it essentially is very safe. And that's what we all are here to do, practice safe medicine. Now, for those of us who did obstetrics, we loved the oxytocin. And everyone in this room knows the oldest peptide, and that is insulin. After the insulin is the oxytocin, and those of us who are surgeons know we love this peptide called vasopressin. It works very effectively in causing vasoconstriction. Well, all of what I'm showing you here is the evolution of peptides. Today in the United States, it's a new wave. It has become something, a household name. And I reside in Florida, where I practice regenerative medicine. I stopped doing surgeries and totally focus on this, and I will share that journey with you. But with this new class of compounds, we're able to see continuing developments and applications of the peptides. One of the things is that I wanted to share with you is that peptides are easier to absorb. Because remember, these are molecules that are very small. So they can penetrate the skin and the intestines. So I have many patients who have chronic inflammatory bowel disease. And through through combination therapy, we're able to deliver these forms of peptides either orally or intravenously or subcutaneously. So these are just some of the methods that we are able to deliver the peptides in the bloodstream. Now, one of the things that I've been able to do is apply the peptide technology to different medical conditions. And one of them being autoimmune issues, metabolic diseases. We all know that today we are plagued with the metabolic disease of obesity. And that issue, I was personally afflicted with that problem, and I was personally a diabetic with osteoarthritis and a fatty liver. And I'm here to share with you my journey and the ability to resolve those symptoms. Now, remember, the peptides, because of their specificity, they bind to cell surface receptors, like a G protein receptor. And by doing that, they're able to turn on intracellular effects. Now, this is a very busy slide, but what I'm trying to show you here is that because of the small molecular size, I'm able to deliver the peptides to the intestines, and I'm able to deliver them to the skin and impact conditions that are allergic diseases, infectious diseases, autoimmune diseases, and even asthma. So, let us give you an example. I have a patient with bronchial asthma. I love combination therapy, or someone with COPD. There is a peptide called GHK copper. GHK copper is known to build collagen and elastin. If we nebulize that peptide, we will get tremendous improvement in the growth of the collagen. And to Dr. Gavek's point, the type 1 and the type 3 collagen is very important. And if you do combination therapy with exosomes along with the peptides, that's when you really are able to master and develop tremendous relief solutions for your patients. So conventional medicine, I'm not here to bash Big Pharma, but the thing is, remember, unfortunately, you many times have unwanted side effects, adverse side effects. And the thing is, with peptides, the results are usually safe, and if dosed appropriately, you're free of side effects. Now, the GLP-1 peptides are very, very popular in the United States. And why is that so? Because we are plagued with the issue of obesity. So the GLP-1 peptide is an incretin peptide. And we all know that the incretin peptides are those peptides that are secreted by the upper GI and the lower GI tract. And what they are able to do is impact our metabolism. Here I am. I wanted to share with you, my friends. Seeing is believing. And when you see what peptide medicine did for me, remember now, I was here a surgeon. And you can see me, a surgeon, to the left, eating lots of steak, fatty liver, osteoarthritis, sleep apnea, hypertension, diabetes type 2, taking 3 meds. I was taking metformin, Actos, and glipizide. My friends, thank God for peptides. As you can now see, I'm a little different. And which peptide did I use? I used the GLP-1 peptide. Simply put, it's an incretin. What does it do? It increases my insulin production, and it sends a signal to the brain, to the appetite center. It tells us that you're full. It also decreases the gastric emptying. And by decreasing the gastric emptying, you eat small quantities frequently. But what is interesting is that the research is really becoming very, very beneficial in multiple other organ systems. Can I tell you, my friends, my cardiovascular system improved. My lipid profile, my cholesterol went from 235 down to 155, perfectly normal. My triglycerides became normal. My hypertension, I came off of the antihypertensive meds, and I got rid of my uric acid issue. I had a complete resolution of my gout. What's being found now is that the GLP-1 peptides, I'm actually seeing lots of patients who have addictions. People who smoke and they can't get rid of the smoking habit. People with alcoholism, I'm able to incorporate that in my treatment protocols. And I'm getting tremendous results. So, just to name a few of the benefits, not only did it help me to get rid of the weight, but also many other comorbidities. So let's chat about some of the peptides that I practice and what I use in my practice. And unfortunately, my friends, the peptides, for whatever reason, they make them very complicated in the name. You just have to know the names. This one I am going to talk with you about, I love. It's called BPC-157, Body Protection Compound. It actually is a peptide found in our GI tract. And the beautiful thing about it is that it protects mucosal linings. It's very beneficial for those patients who you may have in your practice with gastroesophageal reflux disease or gastric ulcers. But guess what? Would you believe it, that it also has an amazing effect in terms of angioneogenesis and wound healing by bringing in nitric oxide. This amazing peptide, I injured my rotator cuff in the gym, tore it by injecting that area with BPC along with something called shockwave therapy, which is another therapeutic intervention using sound energy. My friends, my rotator cuff was completely healed. So in my practice, I use BPC along with other modalities, but I can easily inject this subcutaneously. I can deliver it intra-articularly. I can inject it, or I can take it orally. So these are some of the benefits of this amazing peptide. Very interesting is the use of this peptide for patients with cerebrovascular accidents after having a stroke, or those patients who were in a motor vehicle accident and they've had a traumatic brain injury. Remember, I mentioned to you that it has excellent anti-inflammatory properties. And so, if delivered either subcutaneously or orally, what it has been found to do, it decreases significantly the neuronal inflammation. And there is very good literature on the usefulness of this peptide for neuronal inflammation. I recently published a paper with a colleague of mine, Dr. Ed Lee. Ed and myself are in Florida, primarily the main peptide practicing physicians. And I just, based upon my background of being a urogynecologist, I had a lot of patients who had interstitial cystitis and recurrent cystitis. Would you believe it? The cohort of patients we did, and the study is about to be published, we found that with an intravesical administration of this peptide, BPC, we got an 80% resolution of the chronic cystitis, the Hunner's ulcers, and the hypervascularity. So to say that this peptide is has a lot of potential is not giving it the appropriate credit. It's an amazing peptide that everyone in the room should remember. Now, I like this other one. It's called CJC 1295 or ipamorelin. It's a combination. Why do I like it? Because what it does, it's a combination of two peptides that are stimulating the release of growth hormone from our pituitary gland. Now, I like to give it to my patients at bedtime, just before sleep. Because remember, the pituitary gland, you have a pulsatile secretion of our growth hormone. The beautiful thing about this is it's going to help with muscle mass, it's going to help with fat, metabolism, decreasing the body fat. And for those patients you have in your offices who need an increase in their bone density, I would like you to think about this peptide. For those of you who have athletes or patients who have had an injury to the tendon or ligaments, this is an excellent peptide that will certainly help with the resolution of those symptoms. And guess what? It also helps with sex. So it helps to improve the libido. That doesn't hurt. Now, this is one of my patients, and I wanted to show you what he looked like at the beginning, right? And here he looks what he looked like after 2 months and then after 4 months in his preparation for lifting and a gym competition. This is using the CJC 1295 ipamorelin combination. And of course, discipline, going to the gym every day. But let me tell you, I love this. Now, I also believe, my friends, in combination therapy. So one of the things I also do is bioidentical hormones, and we can discuss this individually. But imagine combining this amazing peptide with testosterone. You will get a beautiful result. Now, I love thymosin beta 4, otherwise called TB500. This is another peptide that has been used orally, intramuscularly, and topically, and is an excellent anti-inflammatory peptide. It's very useful for autoimmune disorders. I have a lot of my patients who I use thymus-based peptides to help them with cutting down on the use of steroids, as well as chemotherapy agents like methotrexate. My goal always is to collaborate with the primary doctor. I never use SERP, my colleagues, but my goal is to collaborate and at the end of the day to take the patient off of the steroids. Because we all know in this room that the steroid is, when we give long-term steroids, that has significant deleterious effects. So I have been in my practice able to take many of my patients off of methotrexate or prednisone by using thymus-based peptides. There's another peptide called thymosin alpha 1. In the United States, to Dr. Garek's point, we have to be so careful, my friends. You live in a great country. You don't have as many stringent regulations that we both have to face. With that said, I'm not talking to you about TA1, thymosin alpha 1 this morning, but it is an amazing peptide, but it has been taken off the market by the FDA. The good news is that you can still get thymosin beta 4, TB500. With that said, if you use it in combination with bioidentical hormones, you will definitely get an increase in muscle mass, and its usefulness also is very well known for muscle injuries. I love combination therapy. I keep talking about it, and I would like to encourage this peptide, which is a combination of BPC 157 and TB500. Imagine a peptide where you have one that has two different mechanisms of action. One increasing nitric oxide production, and another that's enhancing wound healing and has excellent anti-inflammatory properties. Both different mechanisms, but resulting in excellent healing and tissue restoration. So I use this combination a lot for my patients who have had athletic injuries. This is another nice peptide, testosterone. This one, again, is encouraging the pituitary gland to release growth hormone. And it was actually used for patients with HIV. It's now being used and is well known to be used for patients who don't have HIV, non-HIV patients. And it definitely stimulates weight loss. Because, my friends, the thing is, not everyone will be able to tolerate the effects of the GLP-1 peptides. Some patients will tell you that they have nausea, they have constipation, just to name a few of the side effects. But this peptide is a beautiful peptide in the sense that it will help to lower weight. You get excellent results with weight loss, as well as decreasing visceral fat and decreasing the waist circumference. It has excellent cardiovascular effects, improving the lipid profile, and very importantly, helping with conditions like a non-alcoholic fatty liver, just to name a few. And it's easily administered as a subcutaneous injection. I love this peptide called KPV. KPV is excellent for the GI tract because I use it a lot in patients with chronic inflammatory bowel disease, such as patients with Crohn's disease and ulcerative colitis. In fact, I'll tell you, I did a combination of KPV with BPC and another product called larazotide. I had a patient, she was 20 years old, with severe Crohn's, significant bloody diarrhea, and she was taking a chemotherapy agent and steroids. A beautiful girl going to college. Thank God, her parents trusted me, and we did this form of therapy, combination therapy, using KPV, BPC, and larazotide. The larazotide is going to help me with the tight junctions, to make sure that the junctions are tight and to decrease the infiltration of any toxins to the GI tract. The KPV and the BPC speaks for itself. What I was able to do is get her off of the chemotherapy drug, and she now is only taking her peptide medication. Can I tell you, my friends, thank God, she is symptom-free. She has lost the weight because, of course, she had gained the unwanted weight because of the steroid. She's in college, and she was so upset about her appearance. Today, she looks amazing. So KPV is one of those peptides that can be given as a cream, injected, or can be given orally. Orally, in the case of Savannah, she is taking it orally for her Crohn's. So I keep talking to you about the incretin peptides because this is the huge wave that's going on in the United States. I would say to you, at least 50% of my practice is based on this. I have so many patients coming through my door every morning, new patients, thank God, but they need help with their metabolic disorder. Remember, I was in this boat not long ago, 5-6 years ago. I had this issue. And as you can clearly see, there are many, many new drugs coming on the market now. Eli Lilly, Pfizer, all of the big pharma companies are extensively researching these peptides. And essentially, as I said to you earlier, these are peptides from the intestinal tract, from the upper and the lower. And they have amazing effects in the sense that it decreases gastric emptying and motility and acts on the brain. It works, folks. I'm telling you, although I'm no longer taking it, it changed my life. It changed the way I would think. It would change the portions that I would even think of eating. It's truly amazing. I wouldn't even be interested in having a cocktail, to be honest with you, or even wine. Now, the very interesting thing about it is that it works also on the brain. And I'm here to share with you, because I do this every day for my practice. I have a very big population of patients who see me for peptides. I have been able to use these peptides, the GLP-1 peptides, in combination with others to help people to get off of the statin drugs. So remember the simvastatin, the atorvastatin, those agents have unwanted side effects. I personally used to take a statin, and I had significant muscle pains from it. Can I share with you, my friends, after taking the GLP-1, my lipid profile is, as I mentioned to you before, perfectly normal. So tirzepatide is one of the biggest peptides now, very popular in the United States. Pretty much this is the one that this one as well as semaglutide, those are the peptides that are going through my office every day. Multiple patients leave my office requesting this. And I'm just sharing with you here diagrammatically what does it do and what's the mechanism of action. So as I shared, nausea and constipation are the common side effects, and you can also have at the site of the injection, itching. Now remember, contraindications, anyone who has had medullary carcinoma of the thyroid, or a history of having a pancreatitis, anyone, of course, who is pregnant, I would never prescribe this agent for them. Now, I like this peptide. This is MOTS. This is a peptide that, for those of you who are working out and you want to maximize the efficiency of your workout, think of MOTS. We all know that the power source of our cells is in the mitochondria. And MOTS happens to be an exercise mimetic, and it enhances the therapeutic benefits of exercise. It improves conditions like patients who have insulin resistance. You can think of incorporating this peptide to decrease that issue. Imagine you have a patient who is not obese. So you have a dilemma. Someone who you don't want to lose more weight. What do? The patient has high insulin resistance. This is something I would like you to take into consideration as an option, a MOTS. You can give that person this peptide dosing subcutaneously once a week. The beautiful thing also, it has tremendously beneficial anti-inflammatory properties. So, in my other half of my practice, I have a very large aesthetic practice. We do a lot of anti-aging. And the patients love that I incorporate this, as it slows down the aging of the skin and other aspects of aging. Now, one of my favorite peptides to talk about is GHK copper. This truly is a peptide that I use for myself and my wife and everybody in the family. Why do I like this peptide? It's a busy slide, but because I like it so much, I'm sharing with you the benefits of this peptide. As you can see, I'm getting older. I keep trying to fight the age, but the hair is getting thinner. And what can I do? Microneedle my scalp and put in GHK copper. It's just as good, if not better, than the prescription for minoxidil. There's actually a study that has been published showing the benefits of GHK copper and hair growth, thickness, and enlarging the hair follicle size. But it doesn't end there, my friends. Imagine using this product to thicken your dermis. Imagine microneedling the face and delivering this amazing peptide. You know what happens? It rebuilds the collagen and the elastin. You come up with a treatment program, and I'm going to show you some examples. Imagine you doing that for 12 weeks. You rebuild that dermis, and then at the end, you offer your patient another type of peptide, like a hexa 8 peptide that's Botox-like. They're going to love you. Because instead of them having to put Botox in their skin, you can apply a cream. Now, my dearest friend is here also, and those two ladies over here, I think the world of them. You are not all, let me tell you, my friends, these ladies here are forward-thinking and quite frankly brilliant. And when you hear from them, these are the technologies that they will share with you that they're already doing. And I incorporate that also into my practice. So again, forward thinking. Imagine rebuilding your dermis and now using a peptide to relax the tissue, and you're getting rid of the fine lines and the crow's feet, and that's accomplished using a peptide, using a cream versus an injection. The GHK is also able to help me with photo damage, getting rid of hyperpigmentation, and it smooths out any rough skin and improves the firmness and elasticity. So in terms of studies, I want you to share a few with you. There was a clinical study done over a period of 12 weeks, and it showed very definitively in 71 women that with mild aging, photo damaged of the skin, they had tremendous improvement in these aspects using the GHK copper peptide. Why? It stimulated collagen synthesis, it increased elasticity, and production of type 1 collagen. So again, I always like to talk to my patients and to you, my colleagues. No one therapeutic technology works perfectly. So that's why in my practice, what I incorporate is combination therapy. So I would encourage you to think likewise, incorporating peptides into your practice along with exosomes, mesenchymal stem cells, and other forms of therapy. The exosomes, Dr. Gavek, he's an expert. I loved his lecture. He spoke with us about that. I use it extensively in my practice, and I use them also, nebulize them, and I do combination therapy with the exosomes and GHK copper for patients with COPD or patients who have traumatic brain injury. Imagine nebulizing the exosomes along with a peptide like BPC157. You get that combination effect, tremendous improvement in the patient's results. I love platelet-rich plasma. I know you all know this. I incorporate it a lot in my therapies. And what I do, I convert my PRP into a gel. And the reason why I combine it with I make it into a gel by heating it and denaturing it, and then I add a peptide. So the peptide now, by adding the peptide to the PRP gel, I'm able to have a slow release effect to the peptide. So let me give you an example. Imagine someone comes into your office with a musculoskeletal injury, and you need to deliver this peptide over a prolonged period of time. I would suggest you offer them PRP gel, add BPC 157 to that product, and deliver it intra-articularly or intramuscularly in the area of the injury. Let me tell you, you'll have an amazing result from that. Okay. This is an example of a patient in my practice, 24 years of age, came in with a left knee meniscal injury. He came in with the symptoms of the swelling, the pain, the stiffness, difficulty walking, and he would complain of having a popping sensation immediately after the injury. And he noticed he could not fully straighten his knee. An MRI was done, and it confirmed that his meniscus was torn. He opted to trust me. He gave me his trust. Instead of going to do the orthopedic surgery, he went down the road of regenerative medicine. For him, I gave him a combination of BPC, KPV, and 1 vial of exosomes. This was delivered, and 4 days post-injury, I was able to do this therapy for him versus a surgical intervention. Now, I'm not here to bash surgeons. I was once a surgeon, but I'm just opening your mind to the role of regenerative medicine. 2 weeks post-surgery, he subjectively reported to me a 70% improvement in his symptoms. 4 weeks post the injury, 90%. And 6 weeks, 100% improvement. And this was objectively noted on an MRI. The power of regenerative medicine. But what I was also impressed with, by combining the technology of using exosomes along with the peptides, the BPC and the KPV, we got a synergistic benefit to the patient's symptoms. So thank you for having me. I appreciated your time, your attention. It was a pleasure being here with you all.
Si hay alguna pregunta para el doctor, sí.
Hi, Dr. Christopher. I'm Dr. Jaime Daniel. I have about 5 questions for you. Number one, when you told us about your problem with the osteoarthritis, I would like to know more about how did you manage that part using peptides?
How you manage the protocol for the arthritis? How you manage it?
So the arthritis protocol for rheumatoid arthritis. So first, the goal is to decrease the dose of the steroid along with the methotrexate. I incorporate the peptide without changing the dose of the steroid or the chemotherapy agent. So I collaborate with the primary care doctor first, then start my protocol, and I do this weekly. In the case of my patient, I was giving that patient TA1, thymosin alpha-1, twice a week, and we would revisit doses every 4 weeks. Within the first month, we were able to begin lowering the dose of the methotrexate. And then we would do monthly reductions thereafter in collaboration with the primary care doctor, because I don't want to ever offend my colleagues. Then we worked on the patient's symptoms to make sure that there was no flare. And thank God, so far I've not had any patients flare. By utilizing the protocol of combination therapy and slowly decreasing the doses over time, that's how I'm able to accomplish that goal.
How long do a patient have to wait to see a result when they are using a peptide?
It depends upon what you are trying to do. Okay? For example, me, if I give you tirzepatide today, within 24 to 48 hours, you're not going to want to have the filet mignon tonight. You're not. So it works within 24 to 48 hours. That's how fast. So each peptide is different. If I give you BPC, suppose you have a gastric ulcer, you will literally have an improvement in your gastrointestinal symptoms. You'll have relief of the pain.
Is there a way that we can know which peptide is going to be better for the patient?
So you have to think to yourself, that's like how we went in medical school, how we would put things into compartments. So you have to compartmentalize each peptide, because there are 7,000 of them, right? So you have to say to yourself, the GI peptides, musculoskeletal peptides, neuropeptides, and once you know what category you're dealing with, then you'll know the dosing, and then you will know how to administer the doses and the timing that you would expect to see the improvement in the symptoms. Does that answer your question?
Have you ever had an experience using Epitalon?
Yes, very good. Yes, Epitalon. I do a lot of Epitalon.
Can you tell us more about that?
So Epitalon is an excellent peptide for anti-aging and lengthening and preservation of the telomerase. So it's a part of my anti-aging program. There's medical studies that show up to 14 years extension to life by incorporating that peptide. There are different ways of delivering it, IV or subcutaneously. But yes, very good. I like Epitalon.
Epitalon with the exosomes to treat arthritis with very good results in my patients.
You're brilliant. We'll have to talk afterwards.
Okay.
My last question is, can you talk us about the patient who suffered a problem with his meniscus, and the way that you treated him was one session or were there multiple sessions?
One session. With him, thank God, it was one session. One session. And that's why I like Dr. Garrett's presentation. But the thing is, I'm incorporating peptides along with the exosomes. So that's why the combination is to me, very, very beneficial.
Gracias, gracias doctor. ¿Alguna preguntita más? Uy, hay varias. Bueno, doctor.
¿Estos péptidos de qué origen son? ¿Son sintéticos? ¿Cómo los obtenemos?
Yes, they're from a lab. They're synthetics from a lab.
Sí, doctora.
Yeah, I tell her. Can I tell her? She wants me to talk to her about testosterone.
They have them, yeah.
You want me to discuss testosterone with you? I'll chat with you afterwards about testosterone, but yes, I do a lot of hormone replacement therapy in my practice also. So I will chat with you personally about that.
Que después, porque testosterona, claro, testosterona es una terapia de reemplazo hormonal. Estamos hablando ahora de medicina regenerativa, entonces el doctor lo que te dice es que después pueden charlar bien sobre testosterona.
Sí, bueno, el tema es esto, sí, yo voy a conversar con él. Mencioné de la testosterona porque en la ponencia él decía que hacía una combinación de la testosterona
Exacto, exacto, pero es de terapias de reemplazo hormonal, exactamente. Así que ahora después con el doctor él te explica bien todo ese tema. Sí, última preguntita, doctor, sí.
Consultarle al doctor, él creó la vía oral de los péptidos. ¿Cómo proteger la vía que el péptido no se degrade por vía oral cuando las proteínas generalmente se degradan en el estómago?
So some peptides are enterically coated, so you're able to deliver the peptide and prevent the degradation of the molecule. If you have the peptide delivered in an enterically coated manner, in a capsule, that's how you're able to accomplish it. So in my population, I have patients who get BPC, TB500, different peptides. And we have a lab that is able to create an enteric coat, and that's how we're able to deliver it.
Okay.
Thank you so much.
Última pregunta, doctor.
Sí, muy buenos días. Quería saber, doctor, si en su consultorio estos pacientes de mal de Parkinson, epilepsia y tinnitus, respuestas positivas.
Very good question, yes. I do combination therapy for those patients. I have a lot of those patients. Very, very important is just, number one, set realistic expectations. Number two, I'm able to say to them that the peptides, there's a peptide called cerebrolysin. It's a neuropeptide. Another one called BPC157, and one more, CLANC. These are neuropeptides, but when used in combination with exosomes, beautiful result. And what we do, we take a journey together, and I set realistic expectations. My friend, I have people who come to see me in wheelchairs, and they leave walking, but within a month. It takes time. Takes time. So I'll be happy to chat with you all outside. I'm here for you. I'm very honored to have met you, and I will be happy to share with you my personal stories, successes, and my protocols with you. You're my colleagues. I would be honored to do so. But thank you.
Gracias, gracias. Al doctor le encanta hablar. A él le encanta hablar con los otros doctores, así que después también va a estar ahí respondiendo.